Dr. Soto. How are you today?
Hi, Amy. I'm great. How are you?
Good. I wanted to talk to you today about an ER physician who was recently found guilty of manslaughter in Phoenix when 3 of his patients died during liposuction. Can you tell us your thoughts on this and what patients can do to avoid seeing doctors that aren't trained to do liposuction?
Yeah, actually, I read a lot about this, Amy. You're right. The doctor in question was an ER doctor, but he was actually convicted of second-degree murder and manslaughter because there were actually 3 patients that died, not just 1. And they died during liposuction procedures. And the reason that the doctor was convicted of murder and manslaughter and not of malpractice was because the prosecutors and the jury and the judge agreed that because the doctor knew that he was an ER doctor and therefore he knew that he didn't have appropriate training in plastic surgery and he knew that plastic surgery operations have risks, that by doing plastic surgery operations on people, he was showing what they called extreme indifference to human life and safety, meaning that he knew, even if the patients didn't know, he knew that he was not a plastic surgeon and not trained in plastic surgery. And so by offering to do these operations on unsuspecting people, he was putting them at unnecessary risk, knowingly. And therefore, that constituted second-degree murder and manslaughter. Basically, what they were stating is common sense. He's a smart enough guy to be a doctor, therefore he should be smart enough to understand that if you're not trained in plastic surgery, you shouldn't be doing plastic surgery on people and putting them at risk, especially if you're fooling them into thinking that you are trained to do those things in order for them to agree to let you do them on them. And the reason this is such a big deal to me is because right here in our backyards in Orlando, we have an eye doctor named Roger Bassin, who advertises heavily that he's a liposuction expert, and he even calls his practice Bassin Plastic Surgery. The fact is, and it is a fact, he was trained as an eye doctor. Now he has a little additional training in doing plastic surgery around the eyes, but I don't know how training in plastic surgery around the eyes makes you a liposuction expert. There's also a couple of ER doctors in Orlando, and a couple of gynecologists, and even a urologist. Somebody who's supposed to specialize in taking care of kidneys and the urinary tract of men, who's saying that he's a liposuction expert. And I believe that these people are showing the same extreme indifference. They know that they're not plastic surgeons. They know that they have not had formal and accredited training in plastic surgery procedures. And they're all smart enough to know that their lack of training and they're offering to do these procedures and advertising to do these procedures on unsuspecting people is putting those people at risk of injury or even death. Now, to my knowledge, the people here in Orlando haven't killed anybody yet, but they're showing the same behaviors that this doctor in Phoenix was showing when he did cause people's deaths. And so I think it's really very important to educate people about what's going on and how to protect themselves. As far as my advice on how to do that, it's really important to do your homework, not just on the surgeon. Obviously, that's what we're talking about right now, and that is critical. You need to get online and investigate what people's training was in. Just because a doctor offers to do something to you doesn't mean they know how to do it. So you need to get online and investigate what their training was in, if they are board certified, and not only if they are board certified, but what are they board certified in. If I needed heart surgery, it wouldn't make it any safer for me to know that the doctor was board certified if I found out that they were board certified in gynecology. I want to know that they're board certified in heart surgery. The same thing is true here. Dr. Bassin is board certified and he puts that in his ads, but the fact is that he's board certified in ophthalmology, being an eye doctor, not in plastic surgery. So you need to investigate the surgeon, make sure that they have the appropriate training to do what you're wanting them to do for you. And you need to investigate the facility. Make sure the facility is accredited. Make sure that they have all the safety equipment necessary to keep you healthy and alive if there's a problem. And make sure that you investigate the person who's going to be doing anesthesia on you. If you're having surgery, there needs to be an anesthesiology provider, an anesthesiologist, in my opinion, around. And I would never have surgery if the surgeon or one of his nurses was doing the anesthesia. That's just not safe, in my opinion. So I would investigate all three of those things. And if you're at all concerned about any of them, go somewhere else. You know, as far as people after the fact, I know that I see patients who have been injured by some of these people here in town. If you or someone you know has been injured and you find out that somebody did a plastic surgery operation on you that they weren't really trained to do, and you've suffered an injury, it's important to let somebody know. Because if you don't, these people are just going to continue to do what they're doing and injure more people.
All right. Well, thank you so much, Dr. Soto, for your time.
My pleasure, Amy.
We'll see you
Thanks a lot.
next time.
Okay.